Physical screening and general principles of training. A physical examination is an evaluation of the body and its function using inspection, palpation, that is feeling with the hands, percussion, that is tapping with the fingers, and auscultation, that is listening. A complete health assessment also includes gathering information about a person's medical history and lifestyles, doing laboratory tests and screening for disease. The annual physical examination has been replaced by the periodical health examination. How often this is done depends on the patient's age, sex, and risk factors for disease. The United States Preventive Task Force has developed guidelines for preventive health examination that healthcare professionals widely follow. Now we have physical screening. The physical screening is used to ascertain the current musculoskeletal condition of the athlete and should usually be performed early in the pre-season phase of training. Screening can also involve the use of sports-specific fitness testing to ascertain the athlete's preparation for that particular sport. A physical assessment of the athletes allows the sports physiotherapists to obtain database which can: number 1, highlight past and current injuries which can result in specific exercise prescription for managing the condition and preventing further injury. Number 2, identify interplayer differences, that is direct conditioning training program to be set for various level of fitness. Number 3, monitor physical changes over time, which is particularly important in the growing athlete and athlete participating in high training load and or multiple sports. Number 4, ensure effective physical conditioning, allowing for measurement, review and modification to exercise training program involving sports science and sports physiotherapy. A typical physical screening of athlete includes analysis of: number 1, posture; number 2, gait assessment; number 3, muscle length and joint flexibility; number 4, neuromuscular assessment; number 5, task-specific testing. Even the junior team or recreational player who does not consider themselves to be an athlete can greatly benefit from an base level screening from a sports physiotherapist on posture and muscle tightness or weakness. Now we have pre-participation physical examination, that is PPPE. The pre-participation physical examination is an important step toward safe participation in organized sports. The purpose of the PPPE is not to disqualify or exclude an athlete from competition, but rather to help maintain the health and safety of the athlete in training and competition. Now we have goals and objectives. The goals of the pre-participation sports evaluation can be summarized as follows: determine that the athlete is in general good health, assess the athlete's present fitness level, detect conditions that predispose the athlete to new injuries, evaluate any existing injury of the athlete, assess the size and developmental maturation of the athlete, detect congenital anomalies that increase the athlete's risk of injury, detect poor pre-participation conditioning that may put the athlete at increased risks. Now we have importance of pre-participation physical examination. This is the time of year when hundreds of young athletes are lining up for pre-participation physical exams. Pre-participation physical exams are required for athletes to participate in middle school and high school sports and summer camps. With increased media attention on including electrocardiograms as part of PPPEs for the purpose of detecting hypertrophic cardiomyopathy, the leading cause of sudden death in young athletes. Pre-participation physical exams are receiving more consideration. Specifically, sports medicine personnel are reviewing the quality and what is required in this exam to ensure that they are sufficient to identify young athletes who may be at risk for further injury or possible sudden death. Now we have what is the purpose of PPPE. The purpose of the PPPE is to identify athletes that may be at risk for further injury or illness and to refer this athlete for additional medical evaluation prior to following them to participate. The specific purposes include the following. Number 1, to identify athletes at risk of sudden death. Number 2, to identify medical condition that may require further evaluation and treatment before participation. Number 3, to identify orthopedic condition that may require further evaluation and treatment, including physical therapy before participation. Number 4, to identify at-risk adolescent and young adult who are at risk for substance abuse, STDs, pregnancy, violence, depression, and so on. Number 5, to satisfy legal requirement of athletic governing boards. Further, identification of athletes who may be at risk for sudden death is currently a hot topic in the world of sports medicine. The recent studies have indicated that the addition of an electrocardiogram would identify athletes with hypertrophic cardiomyopathy and that this test should be a requirement of the PPPE. Now we have general principles of physical training. The aim of the physical training is to expose the body safely to stimuli that cause physiological and structural adaptation to take place. Positive benefits include an increased capacity to work for longer period before the onset of fatigue and a rapid return to the normal once activity has ceased. However, there is still much to be understood by sports scientists regarding training, and although new training techniques appear frequently, there are several fundamentals and well-established guidelines which should form the basis for the development of any training program. Training to improve an athlete's performance obeys the principles of training, that is specificity, overload, race, adaptation, and reversibility. Now we have specificity. Specificity is an important principle in strength training where the exercise must be specific to the type of strength required and is therefore related to the particular demand of the event. The coach should have knowledge of the predominant types of muscular activity associated with his or her particular event, the movement pattern involved, and the type of strength required. Although specificity is important, it is necessary in every schedule to include exercises of a general nature, for example, power, clean, squat, etc. These exercises may not be related too closely to the movement of any athletic event, but they do give a balanced development and provide a strong base upon which highly specific exercise can be built. Now we have overload. When an athlete performs a mobility exercise, he or she should stress to the end of his or her range of movement. In active mobility, the end of the range of movement is known as active, and position improvement in mobility can only be achieved by working at or beyond the active and position. Passive exercises involve passing the active end position, as the actional force is able to move the limb farther than the active contracting of the agonist muscles. Kinetic mobility, that is dynamic exercises, use the momentum of the movement to bounce past the active and position. A muscle will only strengthen when forced to operate beyond its customary intensity. The load must be progressively increased in order to further adaptive responses as training develops and the training stimuli is gradually raised. Overload can be progressed by number 1, increasing the resistance, for example, adding 5 kg to the barbell. Number 2, increasing the number of repetitions with particular weight. Number 3, increasing the number of sets of the exercise. Number 4, increasing the intensity, that is more work in the same time, reducing the recovery period. Now we have recovery. The rest period between physical training are just as important as the training itself, as muscle damage is repaired and waste is metabolized during these times. The optimum recovery time is between 24 and 48 hours after exercise. Recovery also can be achieved by alternating more difficult training days with easier training days or alternating muscle groups, so an athlete not working the same muscle continually. Improper recovery can lead to muscle fatigue, increasing the potential for subsequent injuries. Now we have adaptation. The rate of the adaptation will depend on the volume, intensity and frequency of the exercise session. In their recent investigation, Burgomaster in 2008 reported that 6 weeks of low volume, high intensity sprint training induced similar changes in selected whole body and skeletal muscle adaptation as traditional high volume, low intensity endurance workout undertaken for the same investigation period. Hole in 2008 stated the time of adaptation may be quicker for high intensity sprint training when compared to low intensity endurance training, but that over a long period the two training regimens elicit similar adaptation. Now we have reversibility. Improved ranges of movement can be achieved and maintained by regular use of mobility exercises. If an athlete ceases mobility training, his or her ranges of movement will decline over time to those maintained by his or her other physical activities. When training ceases, the training effect will also stop. It gradually reduces at approximately 1/3 of the rate of acquisitions. Athletes must ensure that they continue strength training throughout the competitive period, although at a much reduced volume, or newly acquired strength will be lost. According to Michael Brandt, the general principle of physical training is divided into 7 principles, which is also known as PROPS, an acronym for progression, regularity, overload, variety, recovery, balance and specificity. Now we have, why is sports physical important? Sports physical can help an athlete to find out about and deal with the health problems that might interfere with the participation in sports. For example, if an athlete have frequent asthma attack but are starting forward in scorer, a doctor might be able to prescribe a different type of inhaler or adjust the doses so that an athlete can breathe more easily when they run. The doctor may even have some good training tips and be able to give an athlete some ideas for avoiding injuries. For example, he or she may recommend certain stretching or strengthening activities that help to prevent injuries. A doctor also can identify risk factors that are linked to specific sports. Advice like this will make the athlete a better, stronger athlete. Now we have conclusion. General health checks including physical examination performed when the patient reported no health concern often includes medical screening for common conditions such as high blood pressure. A Cochrane review found that general health checks did not reduce the risk of death from cancer, heart disease or any other cause and could not be proved to affect the patient's likelihood of being admitted to the hospital, becoming disabled, missing work or needing additional office visit. Sports physical, which is also known as pre-participation physical examination, is a checkup to assess a teen's health and fitness as it relates to the sports. It is not the same as a regular physical concept. During the sports physical, the healthcare provider look for any diseases or injury that could make it unsafe to participate in sports and reviews the family's medical history to ensure additional tests are performed if necessary.